Well, here we are. It's our first show of 2023. So I want to wish everyone out there a happy new year. And you know what? I'm so happy because today our guest is Dr. Fisher, and we're going to find out, we're going to kind of get our health checkup, our January health checkup, and see how we're going. So stay tuned. Hey, good morning, everyone, and welcome to Scan FYI. Yeah, it's a new year. It's pretty hard for even me to say the words, but it's 2023. And this is our first show of the year because we took a little hiatus. We took a little break for the holidays. So it's great to be back. And it's great to be back having one of our very first guests of the year is you, Dr. Fisher. Welcome.
Thanks. It's a pleasure to be here as always.
Oh, I love having you on the show. And just in case someone out there doesn't know who you are, would you tell us a little bit about you?
Sure. I'm a pediatric infectious disease physician, and right now I'm the acting Deputy Commissioner of Public Health for New Jersey. I
All
also
right.
work at Monmouth Medical Center, so
Yes.
a little bit of everything.
You got a lot going on.
Absolutely. And there's a lot
really
going on
do.
in the state.
Yeah, so so that's the whole point here. So what's happening? Because I know we've all been reading that there is another variant. I guess that's just part of the deal. But how are we doing?
So we're not doing as well as we could be doing, and we're doing better than we might be doing. So it's hard for me to believe it's 2023 and we're still talking about COVID-19.
I know.
But we're still talking about it because it's still out there. It's still causing 15 to 25 deaths a day in New Jersey. And we're seeing it increase in the number of cases. So what do I have to tell you? Something you've heard from me many, many times before. Please keep yourself safe. Get that bivalent booster if you haven't gotten it yet. It was approved back in September. Everyone 6 months of age and older now can get this bivalent booster depending on the timing. So please, if you haven't gotten it yet, get the bivalent booster. It's the best protection we have against this new variant, this new Omicron variant. So that's number one. Number two, for those of us who are at higher risk, who really need to protect ourselves, the masks still work. But you still have to wear them properly over your nose and mouth. And remember, this works not only for COVID-19, but also for influenza and for respiratory syncytial virus. You may have heard about this triple-demic that we have been living through. So there is at least a little bit of good news there. The good news is respiratory syncytial virus, a virus that causes the common cold, but can really give trouble to very young infants and to people who are older, or people who have lung problems or underlying disease. So that respiratory syncytial virus this year started very early, way back in August, September. But the good news is it's definitely, the incidence is dropping very, very nicely. And we think the season is just about over. For influenza, also good news. It came early, hit hard, but it's also dropping, been dropping for the last several weeks. But let's not get too comfortable about influenza. Influenza sometimes has two peaks. And what we've seen this year is this first peak has been just about all influenza A. So it's very possible we could still have a second peak, and that peak would be influenza B. So there's still plenty of time, but not a lot of time. So if you haven't gotten your flu shot, go out and get that flu shot. This year, for the first time, the Centers for Disease Control and Prevention and the public health people have recommended that people 65 and older get that higher dose vaccine or the vaccine that has an adjuvant. What's an adjuvant? It's something that helps your immune system respond better. So if you're 65 and older, particularly important to protect yourself. And, we know that as you get older, your immune system doesn't quite function as well. Lots of people have other problems going on. So it's very important that we do everything we can to get our older folks, like myself, protected.
Yes.
So get that bivalent booster, get that flu shot, wear the mask if you're indoors and there's lots of people around, or even if you're outdoors and there's lots of people around. So this will protect you not just from COVID, but also from the flu. So that's my update.
Oh, it's a lot to absorb, isn't it? So
Yeah.
let me ask you, I'm curious now. So Dr. Fisher, you're saying that 15 to 20 people in New Jersey are still dying every day from COVID. So the people that are hospitalized now and sadly are dying, are these people who had the were they vaccinated? Were they unvaccinated? Did they have other situations happening?
So we don't have all the exact information on all the people, but what we know is if you're unvaccinated, you have 100 times greater risk of dying from this disease.
Wow.
If you are unvaccinated, you have a much higher chance of ending up in the hospital. So vaccine helps, and it's important. The bivalent booster is what you need for this current variant. So if you long time ago you got your primary series, you'll still have some protection from that, but not nearly as good as if you get that bivalent booster. That's going to be your best protection.
So for people who are listening and are a little bit unsure, which I guess is still possible. So what are some of the conditions that might make you especially vulnerable if you have not been vaccinated?
So the first is age. If we look at our deaths in New Jersey, 80% have occurred in people 65 years of age and older. 80%.
Oh, that's
so age alone is a huge deal. But there's also anything that affects your immune system. If you're on medicine that compromises your immune system, if you've had a transplant, if you need to have steroids or biologics because of some autoimmune disease that you have, those are going to put you at higher risk. If you have underlying lung problems or underlying heart problems, that's going to increase your risk from a respiratory illness, not just COVID-19, but influenza as well.
Yeah, because we can't forget about the flu. And so as someone who might be compromised, maybe because they're going through chemotherapy or even something like that, that I would think also could make you especially vulnerable, even if, you were vaccinated or not, your immune system is somewhat suppressed, right?
That's absolutely true. So anyone who's on chemotherapy or getting, any kind of medicines that decrease their immune system, they have to be especially careful. And those are the people that need to wear the mask, keep your distance, stay out of crowds if you can, stay away from sick people, and, wash your hands. We always like to tell you to wash your hands. And a big one, if you don't feel well, please stay home.
Right.
Don't go,
right.
Don't go back to work if you're not feeling well, because you'll expose other people and spread all these viruses around.
Even if you just have a cold, don't go to work. Don't go to a gathering. I was telling you before we went live that over the Christmas time, I had a cold, and a cold is pretty lousy when you get older too. I pretty much spent it on the couch in my pajamas, not the way I saw things going. And I missed a big Christmas Eve gathering, and this was the first one they had in maybe 3 years. Find out a few days later that 3 of the people who were there tested positive for COVID.
There is this new variant that we have is very contagious, and your story I've heard a lot of times.
Yeah.
And in fact, I was supposed to go to a Christmas Eve party, and we found out that the spouse had COVID-19, and we said, nope, I think we'll pass that by, even if it's, even if it's close and they could get by with coming. We said, nah, well, let's pass that one by. So I think you have to look at your own risks, look at your personal risks, and decide what you should or should not be doing. But for everybody, if you're sick, please stay home, because you
Absolutely.
don't know who you're going to be around, or who you're going to be exposing, or whether those people are at higher risk.
You don't even want to give somebody a cold, for God's sakes, a cold. Nobody needs your cold. Keep it to yourself, please. But
Exactly right.
the other thing is that I hear from people, oh, I didn't know you could do a home test for COVID. And I'm thinking, really? After all this time, people are still not you can go online. I just had 4 more delivered right to my house. And while I was home, and I tested myself. It's so easy to do, everyone, right? It's nothing. It's not like the initial thing where they stuck the thing up into your brain. That's how it felt. But yeah, I feel like everyone should have those home COVID tests always,
And
and
those are
know how to
available.
use them.
You should know how to use them. And those are available free right now.
Yes.
You
Yes.
you go on, it's an easy website. It's the government website. You can get them free. You get 4 kits free. And you can also get kits through if you're on Medicare,
Mhm.
you can get more free kits as well. So yeah, every single person should have those at home, and should, read the directions, know how to use them. They aren't that difficult. But read the directions carefully, because you don't want to give yourself the false impression that you don't have a problem if you do.
When I first got them, in the house, and by the way, you can just Google free COVID test and it'll take you, Dr. Fisher will take you right to the website.
Perfect.
But when they first came to the house, I just thought to myself, I'm just going to do this right now so I know how it works, because then, in the heat of the moment, I don't have to panic, like, how do I do this? Because my understanding too is, if you don't do it correctly, you will get a false negative or a positive, and then what was the point? So take the time. If you've never done a test yourself, take the time to do it. Even whether you have COVID or not, that's irrelevant, just so that you know what you're doing. I think that's important.
That's important, and that's great advice.
Yeah.
And remember, you may get a different kit in the mail than the one you used last time. So
Yes.
there are a
Yes.
variety of different kits. The ones that come to you from the federal government are all appropriate kits. They're all standardized. The ones you buy in the drugstore, they're all good kits, but they work a little bit differently. So you have to read the directions for each of the kits.
But they're easy. It's easy to do. And what was it? 15 minutes, I want to say. It takes 15 minutes, and it's so easy to read this little meter. It's very simple, and it's just so waste one test and make sure you know what you're doing. I think that's the thing to do.
Sure.
But above all, use common sense. There's no substitute for common sense. But we've said this before, common sense is not common.
Correct.
When will it ever be common? I don't know.
I think so. I don't think ever.
I was recently at a little community theater event, and it's one thing to just sit in your seat and you don't really have anyone like on top of you. But then there was a reception. We went into the reception initially, and it was like shoulder to shoulder, and all of us agreed, you know what? This is too close for comfort. We're leaving. So we all felt the same way. I would say there was not a single person in the room with a mask. And you know what? It didn't feel right to me. It just didn't, to have people sort of on top of you. And I don't know who you are. So we left. That was us using our common sense. We knew it didn't feel right.
Yeah. And remember, with the flu, you're contagious a day before you get symptoms.
Oh.
So even people who think they're fine, I don't have any symptoms, I'm fine. You could be incubating influenza, and you could be shedding the virus, and you could be contagious. So watch those gatherings. And, when it's cold, we all gather inside, and sometimes we get too up close and personal.
Mm-hmm. Yeah, I think in the wintertime, obviously we're not having barbecues outside, But my feeling is I'm okay with just a few people, no big crowds, just a few people. And I'm still on guard. I just can't help it. I'm on guard
As you should be.
because again, just having a cold as an older adult, it was pretty unpleasant, and it took a long time to shake all of the symptoms. That's the thing. As you get older, it's and of course we still haven't found the cure for the cold. We're waiting for that to happen. I don't know. Is there any news on that horizon?
Well, actually, there is. There are a couple of new antivirals that are being tested. There was one that worked, but its side effects didn't allow it to be generally used. So hopefully they'll come up with one that doesn't have the same side effects, and maybe in a year, maybe we'll see a medicine for the common cold. But you're right.
That would be nice.
It's those symptoms hang on. They if you have underlying asthma, it can trigger your asthma. It's the common cold is not a friendly thing, especially I think during the winter.
No, it's never fun to have a cold. Now, are you, I remember you said something about, all right, so we might wind up needing a COVID booster periodically, but does it seem likely that the COVID booster and the flu shot will be one and the same, so we don't have to get two shots?
I think that's too early to tell. They're definitely working on that technology. It's possible that there will be some of those options available. But both shots will have to be tweaked each year. So that makes it a little bit more complex, a little more complicated. So I think we just have to wait and see.
Okay, we have to wait and see. Well, as always, Dr. Fisher, it's always so good to hear from you. And somehow I always feel better after speaking with you. But, guys, it's still out there. I can't believe we're still talking about it, but we are. But it's not just COVID, it's influenza, it's just the common cold. And if you don't feel well, please stay home. Please be respectful of everything else, because, at the end of the day, somebody might look just fine, but you don't know what they're going through, and you don't know who else might live in their house that they're going to bring this home to someone else. So I feel like we have to be very respectful of everyone that we come in contact with, especially if you're going to work. Yeah.
I couldn't agree more.
Let's do that, everyone. Let's do that. All right. Well, again, Dr. Fisher, thank you for being with me today.
It's a pleasure, and Happy New Year, everyone.
Happy New Year, everyone. And we'll have an update in a few more months. We'll check on us, New Jersey, see how we're doing.
Sounds good to me.
Okay, remember out there, if it's important to you, it's important to us. I'm Andrea Tarr. We'll see you next time on Scan FYI. Bye, everyone. Bye, Dr. Fisher.
Take care.